Nursing care plan for chronic obstructive pulmonary disease. Nursing assessment, patient history. Past and current respiratory illnesses, smoking history, exposure to environmental pollutants, and family history of respiratory conditions. Assess patient's symptoms: coughing, sputum production, SOB, wheezing, and chest tightness. Respiratory assessment. Monitor respiratory rate, depth, and pattern of breathing. Assess oxygen saturation levels. Auscultate the lungs, such as wheezes, crackles, or diminished breath sounds. Physical examination. Assess the patient's general appearance. Observe for signs of respiratory distress, such as cyanosis, bluish discoloration, or pursed lip breathing. Monitor vital signs. Assess the patient's chest for abnormalities, barrel chest. Sputum. Assessment. Observe the color, consistency, and amount of sputum produced. Psychosocial assessment. Nursing diagnosis. Ineffective airway clearance related to bronchoconstriction, increased mucus production, ineffective cough, ineffective breathing pattern related to chronic airflow limitation, impaired gas exchange related to chronic pulmonary obstruction, imbalanced nutrition, less than body requirements, related to increased work of breathing, air swallowing, drug effects, activity intolerance related to compromised pulmonary function, risk for infection related to compromised pulmonary function, retained secretions, and compromised defense mechanisms. Nursing diagnosis. 1. Ineffective airway clearance related to bronchoconstriction, increased mucus production, ineffective cough. Goals: to improving airway clearance, planning, monitor vital signs, keep patient's room as dust-free as possible, administer bronchodilators as prescribed, mobilize the patient when stable, implementation, monitored vital signs, kept patient's room as dust-free as possible, administered bronchodilators as prescribed, mobilized the patient when stable, evaluation, blood pressure, pulse rate, respiratory rate, body temperature, a saturation level. Nursing diagnosis. 2. Ineffective breathing pattern related to chronic airflow limitation. Goals: to improve breathing pattern, planning, encourage breathing exercise, discuss, demonstrate relaxation exercises, encourage patient to assume position of comfort, monitor vital signs, auscultate lung sounds, implementation, encouraged breathing exercise, discussed demonstrated relaxation exercises, encouraged patient to assume position of comfort, monitored vital signs, auscultated lung sounds, evaluation, lung sounds, wheezes, crackles, blood pressure, pulse rate, respiratory rate, body temperature, saturation level. Nursing diagnosis. 3. Impaired gas exchange related to chronic pulmonary obstruction. Goals: to improve gas exchange, planning, monitor vital signs, keep strict bed rest, keep Fowler's position, administer medication as prescribed, bronchodilators, corticosteroids, remove irritants, assess respiratory status, monitor the patient's cough and sputum production, encourage effective coughing techniques, implementation, monitored vital signs, kept strict bed rest, kept Fowler's position, administered medication as prescribed, bronchodilators, corticosteroids, assessed respiratory status, monitored the patient's cough and sputum production, encouraged effective coughing techniques, evaluation, blood pressure, pulse rate, respiratory rate, body temperature, saturation level, sputum color. Nursing diagnosis. 4. Imbalanced nutrition, less than body requirements related to increased work of breathing, air swallowing, drug effects. Goals: to improve nutritional level, planning, give oral care before eating, encourage frequent small meals, encourage to eat high-calorie, high-protein snacks, cheese, nuts, offer liquid nutritional meals, monitor weight daily, avoid foods producing gas and abdominal discomfort, implementation, gave oral care before eating, encouraged frequent small meals, offered liquid nutritional meals, monitored weight daily, evaluation, weight daily, to be evaluated later. Nursing diagnosis. 5. Risk for infection related to compromised pulmonary function, retained secretions, and compromised defense mechanisms. Goals: to prevent infection, planning, monitor vital signs, administer antibiotic as prescribed, monitor WBC level, Assess inflammatory signs, implementation, monitored vital signs, administered antibiotic as prescribed, monitored WBC level, assessed inflammatory signs, evaluation, know any inflammatory signs but patient has risk for infection. Blood pressure, pulse rate, respiratory rate, body temperature,